All right. So thanks again so much for spending your evening with us or spending an hour this evening with us. Uh, my name is Dr. Kathy Lee. I'm an admissions counselor in the Office of Admissions at Case Western Reserve University School of Medicine. My colleague is here today. Tom, you want to say hello?
Yeah, hi, thanks, Dr. Lee. Good evening, everybody. I'm Tom McKenzie. So great to see so many faces, familiar faces on the Zoom screen. Feel free to turn your cameras on. We love seeing faces. No pressure. I understand if you're not in a setting to do so. Totally fine. But if we do love to see faces. So don't hesitate. Um,
Yeah.
yeah, and also I might just check in and ask our panelists to just put like maybe M1 on their name. I see Sherry and Megan have already done that, and now Tony too. But you'll that way you can kind of identify our medical students too. Okay.
Yeah.
Good to see everybody.
Great suggestion. Thank you so much, Tom. Yeah, so we are going to get right to it. We're going to allow our students to introduce themselves. Oh, I think we have 6 students with us now. So one at a time, we're going to, I'll call on somebody to begin with, and you can introduce yourself. Tell me where you're from, and then talk about a couple of the pathways and electives that you are involved in. And so let's start with the first person I see on my screen, which is Nisha.
Thank you. Hi, everyone. I'm Nisha, an M1, and I'm involved in it's a long name, but it's the wellness pathway, the culinary medicine and wellness pathway. I think you'll see it like JJM, Mandel Wellness Pathway. So any questions on that, I'm happy to answer. And then I also did the medical Spanish elective. I did intermediate too, and then I'm planning to do advanced. So can also answer questions about that too. It's nice to meet everyone.
Thank you so much. Anna, you want to go next?
Yeah, hi, I'm Anna. I am from just outside Chicago. I'm part of the urban health elective or pathway, and then I also did the dermatology elective.
Thank you. Megan, you're next I see on my screen.
Hi, I'm Megan. I'm from Cincinnati, so just a couple hours south of Cleveland. I am in the addiction medicine pathway, and then I've been involved in a couple electives. I did opioid epidemic, the CCF plastic surgery, and I'm currently in the self-directed surgical skills elective.
Thank you. And Sherry?
Hi everyone, it's good to see everyone. My name is Sherry. I'm from Chantilly, Virginia, which is in Northern Virginia, just outside DC. And I'm in the medical education scholars pathway, and I took several electives, two of which are the surgery shadowing elective, and I'm also in the gross anatomy elective.
Great. Thank you. Tony, you're up next.
Hi everyone, my name's Tony. I'm originally from the Boston area, and uh, I'm currently in the medical humanities pathway. And then in the fall, I took a healthcare in Asiatown elective, and then I'm currently also taking the ultrasonography elective.
Very cool. And last but not least, Grant is with us as well tonight.
Hi everyone, my name is Grant. I'm actually from here in Cleveland, and I was also in the medical Spanish elective, and I'm currently in the cancer care elective.
Awesome. What a great variety we have with us tonight. So I think at this point, we just want to open it up. We want to allow you, accepted students, to ask your questions. You can call on specific people if you want, or if you just have a general question for the group, just say, hey, this is a general question for the group, and then ask your question. Whoever wants to go ahead and unmute yourself. As well as Tom said, if you want to drop any questions in the chat, or if you have a question that you really don't feel like asking the whole group, you can drop a question in the chat to either Grant specifically or Tom specifically, and they can address your question that way. So who is going to be the brave first person to unmute? And then anybody else, you can raise your hand, and we can kind of take it one question at a time.
Hi. Hi, I'm Lucia. I'm actually interested in the world medicine pathway. And I think none of you said that you were in that, but I was just wondering if anybody had any insight into that.
Or do any of you know somebody who's in the world medicine pathway? Have you gotten any feedback about it?
So I know students who are in the world medicine pathway. So I can't speak directly to what it's like in the pathway. So take everything I say with a grain of salt. But from what they've told me, they really love the advisor. And I've gotten to spoken with the faculty advisor, Dr. Lamb, who directs the world medicine pathway. And having spoken to her and also having heard about her from students who are in her pathway, they all adore her. And she is a pediatrician who's worked in various countries. So she's very well connected and very passionate about world medicine. Um, so that's all I can really say, but I know that all the students who are in that pathway love the experience and they feel like Dr. Lamb's an amazing and personal mentor. But I don't have any personal experience myself, so
Awesome. Thank you so much.
Hi. I was just curious if general question to the group of like how they actually work, how the pathways work, what is the time commitment for each of them? Kind of, oh, yeah, just generally, I feel like I'm not so clear on how they're different from electives or they're just curated electives. Thanks.
I can start with this one. So, each pathway is going to be different in terms of kind of like the time commitment, what it looks like on a week to week or month to month basis. Um, my pathway, we are required to take the opioid epidemic elective, and you can take that at any point during your M1, M2 year. It takes like half a semester. So I took it during the fall. So I would meet once a week for that elective for 2 hours. And then now my pathway meets once a month, and we'll continue to do that throughout the M1 and M2 years. Pathways usually tend to be focused on the M1, M2 years, M3, M4, you're in the clinic. So it's a little bit harder. But in my pathway, I will do rotation and addiction medicine to continue my pathway experience. So the pathways are more longitudinal and the electives tend to be shorter. So you'll take an elective during the fall or you'll take an elective during the spring. And the electives also vary in time commitment from once a week to you do a couple of shadowing experiences that you kind of manage on your own. So it's very dependent, elective to elective, pathway to pathway, but the pathways are longitudinal and the electives tend to be shorter experiences, if that helps answer your question.
The culinary medicine one I think is like slightly different because it's more wellness focused. So we meet like every other week and we either do like a 1 hour lifestyle medicine session. We had like a sleep medicine doctor come talk to us about how to get good sleep, which is really helpful. And then I just came from basically like a 2 hour, it's slotted for 4 hours, but it goes technically like 2.5 hours of cooking. So while it does sound long, it's really, really relaxing and you get to eat the food. So it's always helpful to kind of know and like talk to the students in the pathways because it may sound like a big commitment, but in actuality, you kind of need the break. So that's also helpful.
Yeah, I'll just add on that I feel like the time commitment for pathways is different depending on what pathway you're in. So for my pathway, which is the medical education scholars pathway, in the fall, last fall, we met once a week for an hour, each time. And this semester, we're meeting like once every other week, for about 2 hours. And my pathway is also one of the ones that has required summer research. So, like I feel like there's a large range of like what the time commitment is for different pathways.
Yeah, I will just echo like it is super different. Urban Health meets once a month for 2 hours, and there's nothing required outside of that. But they'll tell you all of this before you have to apply. There's like a little fair kind of where you can go talk to students that are currently in the pathway, along with usually their advisor, before applications are due, so you can just get a feel for all of them, and they'll tell you like exactly what's required and expected of you.
Yeah, for medical humanities, I think medical humanities meets like the time commitment is a little bit more regular than some of the other pathways. We meet every Thursday for an hour and a half throughout M1 year and M2 year until dedicated, which is at the end of M2 year. Um, and usually those sessions will either be talks or they'll be like led by older students. Uh, some of them are a little bit more formal, but a lot of them are also like very casual and informal, and they're just kind of like an hour and a half to like talk about the humanities and medicine and really whatever we want to talk about. Um, and then there are some other requirements on top of those like regular meetings, but those are like the consistent commitments, I guess.
That was great feedback. Thank you so much. Why don't we move on to Elizabeth? What's your question?
Yeah, thank you. I was just wondering, like, similarly for electives, like how many electives you guys suggest taking at a time, and like what your experience is with electives, and yeah, just some general info about that. Thank you.
I can say a few things about this. I mean, it really depends on you as a person and your schedule. I feel like most people who take electives either do like one or two, see if they're interested in them. But at the end of the day, all electives are 0 credits. It's just for your benefit and your own educational like interests. So you can always start an elective and then drop it if you need to, if you feel like it's too much. But most people like do pretty extensive research into the electives or like talk to upperclassmen who've taken them to ask what the time commitment is because they vary from elective to elective. Like I know for me, one of my Spanish electives was just once a week for like an hour and a half. Whereas like something like the anatomy elective is very extensive. It's multiple times a week for multiple hours. So you kind of have to look into that. Usually when you get an email about when you can sign up for them, it kind of details these things like the time commitment and what's expected of you in terms of completion of the elective. Um, but I've seen people take one or two electives without having any trouble.
Thank you. And could I ask a follow-up to that? Is what's the timeline for like deciding whether you want to do an elective, or similarly, like whether you want to do like a pathway?
Usually I'm not in a pathway, so I'll let someone else answer that one. But
Okay.
for electives, usually there's an email that goes out that says, "Hey, this elective is open for sign up," and it'll say like either there's limited spots or there's not limited spots, and it'll say when the deadline is to sign up.
Oh, okay.
It's usually a Google form that you just sign up, or fill out to show your interest, and then they email you if you get a spot or when it's starting and what's expected of you.
Okay. Thank you.
Go ahead, Meg.
Okay. So I was just gonna add on to that. So electives also happen. There's a couple that happen like every semester. So just because you don't get a chance to take a certain elective, like your M1 fall, doesn't mean that you won't necessarily get to take it at some point. Like I am in the self-directed surgical skills elective this semester, but I wasn't in it in the fall. So it kind of depends a little bit on what's being offered when. And as for when you sign up for a pathway, that's going to be earlier on in the year. I want to say we applied for that in September-ish. So around the start of block two, they do the elective fair, and every elective has an application that you fill out, and then you'll hear back from the electives within a couple of weeks, and then things get started. I think mine started around October. So yeah.
Thank you.
Yeah, and I would say like for pathways, they try really hard to make sure you don't miss the deadline for pathways because like Meg said, there's like a whole pathway fair that you're basically required to attend. I mean, I don't know a lot of people who didn't attend that, so I just assumed that it was required. So yeah, they like make sure that you know when to sign up if you want to.
Great. Thank you so much. Yeah, you will get a lot of information when you start, and it can be a little overwhelming in the beginning, but there's always people to help answer your questions and help navigate through those different decisions. So, yeah. Nico, go ahead. What's your question?
Yeah, I specifically wanted to ask about somebody mentioned a cancer care elective, and I wanted to hear more about that.
Yeah, I can talk about that. So, basically, what you do is you sign up for this elective whenever they have the sign up sheet come out. For me, I took it this, or I'm taking it this semester, and the sign up sheet came out maybe a couple months ago. And it's self-directed insofar as you are given a list of tasks that you have to do, and you just have to complete them by the end of the semester, or I guess not the end of the semester, because the end of the semester for us is the very end of May. But for this, the deadline for these activities that we have to take part in is due, I think, by the first week of May. And so basically, Case is really well connected with various different cancer specialties. So you first say whether or not, or whether you're more interested in surgical oncology, radiation oncology, or medical oncology. And then based on your preference, they try and match you with someone or a preceptor who's specifically in one of those specialties. So for me, I put surgical oncology, and I was matched with a surgical oncologist at UH. And to complete the elective, you just have to do 3 half days of shadowing. So you kind of get connected with your preceptor, and then you coordinate those days based on their schedule. You say like, hey, I'm free these days. What days do you have patients? What days do you think would be most helpful for me to come observe? And then you kind of coordinate with them, and then you go do your 3 shadowing days. I've done 2 of the 3 so far. For me, my preceptor sees patients in clinic on Wednesdays from like 10 to 1. So I go in, I hang out with him, we see some patients, we round throughout the hospital, and then we just talk in the meantime. It's usually me, him, and then um, like a general surgery fellow who's on his service. So it's usually us 3 hanging out, talking about cases, going through charts. Um, and then the other requirements are that you have to go to a tumor board. And from those might vary depending on who you get paired with. But for me, all of the surgical oncology tumor boards are virtual, and they happen multiple times a week. So um, I haven't chosen which one I want to do yet, because I was waiting for them to do a tumor board that was kind of related to some of the stuff we were learning in class. So they have like a GI related tumor board coming up that I was going to go to, because we are past the GI block. So I felt like that would be a good one for me to go to. And then after all of these sessions, you fill out a little reflection form to talk about what you learned, what you saw, what you liked, what you didn't like. Um, and then you have to watch the oncology match panel, or not the match panel. I think it's like an interest panel, where it's basically just like an hour-long video that they have recorded, where oncologists from multiple different specialties come and answer questions about it. It's just for learning purposes. And then one of the last requirements is to is to attend the elective PowerPoint party, which we're going to have, which is where you make a PowerPoint about everything you learned, and you can make it as fun and creative as you want. And you come and just share with your other classmates who are in the elective. But like I said, it's super flexible. It's a lot of fun, and I've learned a lot so far. But it's really nice that they kind of just hook you up with a preceptor, and then you can kind of build your schedule of how you're going to complete those things around whatever else you have going on.
Perfect. Thank you so much. And quick follow-up question, actually. What if you don't know between medical, radiation, and surgical oncology, or do you just suggest figuring that out before the elective?
So I mean, you're not guaranteed to get the one that you put as your preference. They try their best to match you with someone, but if you put no preference, they'll just put you with whoever's available. So you really don't have to know, but you'll probably learn a ton no matter who you're with.
All right, thank you so much.
Yeah.
For the people who took medical Spanish elective, is there like an exam or something you have to do to predetermine? Because I know it's like you have to speak a little bit to be in the intermediate, but if you're like in between the beginner and the intermediate, for example, um, and also like the vibes, is it just like basically like high school Spanish where someone's just lecturing you and you just have to converse with your other classmates, or is it a little more just like, you know, I don't know how to phrase the question.
Yeah, so I took intermediate one, so I can talk about that, and then Nisha, you can talk about intermediate two. So intermediate one, it started with about 30 people, and then after the first class, I think it dropped down to about 7 because a lot of people came in thinking that they were literally just gonna start from scratch. But you do need a tiny bit of background because it's not beginner Spanish, it's intermediate, so they expect you to have a little bit of a background. And for a lot of people, like taking Spanish in high school or a little bit in college was more than enough to be set for the intermediate one. Um, but they send out a syllabus beforehand. Like when you sign up for the elective, you say what your proficiency is. Um, and they're not going to like deny you based on that. They still let you take it no matter what your proficiency is. It's up to you whether or not you want to stick with it. But for intermediate one, they sent out the syllabus and it was really grammar focused. It wasn't so much based on like medical terminology or practicing speaking with patients or anything like that. Those are kind of the upper level ones. But the one that I did was pretty grammar focused. So there wasn't a ton of speaking involved. We did have a quote final exam where we just got together and kind of had a short conversation in Spanish just to make sure we could use those grammatical concepts that we learned throughout the year or throughout the semester. But overall, it was pretty laid back. The Spanish experience I came in was just from listening to Spanish online. I had like 300 or 400 hours of just listening to Spanish. I had never done specific practice with grammar or vocab or anything like that. Um, and so that's kind of why I opted to take intermediate one because I saw that it was more grammar focused, and that's kind of where I was lacking. But all in all, it was pretty good. You don't need a ton of experience, but you do need some. You might be a little uncomfortable if you don't have any, just because at least in intermediate one, my professor spoke to us mostly in Spanish.
Yeah, I also like just have positive things to say, which is why I want to do the advanced one. I think so. Intermediate two was it kind of like bypassed grammar and went straight to like a medical encounter, which in a way I kind of think that made things slightly easier because it wasn't so technical focused. We basically throughout the I want to say it was like 10 classes we did we learned how to give like each part of like a clinical encounter. So we started off with like how to introduce yourself, ask about the chief complaint in Spanish. Then we went to history of present illness and like what questions to ask, then down, and it actually ended up being really good because in the fall, that's when you learn as a medical student how to do all those things like normally. So if that interests you, and you do have some level of proficiency where you can kind of engage more conversationally, I think that is a really good idea because it ended up helping like not just me, but like from a lot of other peers helping you kind of keep up with like your normal communication workshops. Um, our professor honestly didn't, for the most part of it, did not speak all in Spanish. So I think in a way, like I think there's a lot of people from all different proficiency backgrounds in that. Those who took Spanish classes, those who just had experience with family or having traveled to some place. So I would say if you want more of a conversational experience, try intermediate two. And at the end of the day, it's 0 credit. And the assessments that we had were The first one was just it was not even graded. It was just to see how you are. So you went to the standardized patient center and you met with a standardized patient for 10 minutes. And at first it was nerve-wracking, but it ended up just being a 10-minute encounter, and they give you really great feedback, and it's just kind of like a no judgment zone. And then you come back like about a month later and do it again for quote like a final exam, but still it is very chill. And she gives you, the professor's amazing. Her name is Dr. Ines Cuevas, and she gave really good advice. So yeah, I don't know. I'm trying to think if there's anything else with the Spanish elective. She also offers, like for me, it was really important to try to see if I could incorporate this at like a free clinic or a Hispanic clinic, which there are a lot in this community. So she also gives opportunities to like later on like shadow her and like work with her at her pediatric clinic, and see things out in the community. So it's also a good way to kind of network and get your fingers in that if that's what you want to do too.
I just wanted to add, I didn't take the Spanish elective. I was in it for one day before I realized it conflicted with my other elective. But they send out this form and like all these FAQs for you to decide what level is best for you. So they have like kind of detailed advice like, oh, if you know X, Y, or Z, then you should take this level. So for example, like it said, if you took AP Spanish in high school, you're probably fine to go to intermediate too. But they also let you switch. Tons of people switched levels after the first class. So it's like not a ton of pressure to decide what's best for you immediately. You can change it around.
Great info. Yeah, absolutely. Did you start off in Duolingo? Anybody use that?
No, I'm anti Duolingo.
You're anti-Duolingo? Oh no.
I don't think it works at all.
I tried it for a couple of months and I did not get very far. So I think I'm in your camp too there, Grant.
Also on the topic of Spanish, this is unrelated to the elective, but I did see in one of the daily emails that Case will actually pay for your like official proficiency certificate if you get to a point where you feel really good about it and want to take an exam, like a standardized exam to get certified at a certain Spanish level, which I thought was cool.
Yeah, and the reason to do that is the only way in which you can interpret an encounter legally is if you're board certified in medical Spanish interpreting. So it'll be a really cool opportunity if you get to that point. But
Thank you so much. Elizabeth, another question for you?
Hi, yeah, if that's all right.
Yeah, sure.
Perfect. I was just wondering if any of the experiences you guys have had in the pathways or electives have helped you narrow down your specialty choice, and if you could talk a little bit about your experience that way.
I can start with this one. So I was in the Cleveland Clinic plastic surgery elective over the fall. And I had some experience over my gap year, like working with a plastic surgeon. So I kind of wanted to explore and see if that was like the right fit for me, especially because it's a very competitive specialty. So it's helpful to know early. And through shadowing and my other experiences, I think I've leaned away from plastics, but I still feel like I learned a lot during that elective. Like I learned a lot of things about surgery in general and OR etiquette, how to scrub in. We practiced suturing. We got to do micro suturing with the residents at the clinic. So it was a really cool experience, and it definitely helped me inform what I'm thinking specialty wise moving forward. Even if it wasn't in the affirmative, I don't regret taking it at all. It was a really cool experience. And I think one of the great things about being an M1 is that kind of freedom to explore and take electives and things that you're like, oh, I might be interested in that. Like, let me just see. Even if you're not like gung ho, like, yes, that's my specialty. It's a great time to explore and see different things.
Thank you. Yeah, I really appreciate your insight.
Yeah, I'll just add that I feel like so I took the UH surgery shadowing elective, which is a lot like the CCF plastic surgery elective where you like shadow a surgeon, but it's at UH, and I shadowed a colorectal surgeon. And I feel like it kind of like really solidified my, well, I wouldn't say solidified since I'm only an M1, but it made me lean more towards like pursuing like general surgery residency. And my pathway, which is the medical education scholars pathway, I feel like really solidified my decision to want to go into academic medicine. Like through that pathway, I was really like, yeah, like I want to teach as a doctor. So I feel like that was a really um good experience, yeah, for me.
Awesome. Thank you. Sounds like, yeah, lots of good opportunities as an M1 for sure.
I'll also add that there are also a lot of like even the electives that aren't like specialty focused will help you kind of decide in more generally what direction you want to go in. So you can still explore specialties even through electives that aren't like the cancer care elective or the cardiology elective or so on and so forth. So for example, like in the ultrasonography elective that I'm in, it's very broad because we just practice. We have like one of the anesthesia folks at Cleveland Clinic help us with dummies and with ultrasound, like put in lines and put in like practice doing central lines. But a lot of specialties do central lines. It's not just anesthesia, emergency medicine, surgery, radiology, they all put in lines. So it just helps you, like, I would recommend just like kind of trying out, like, you know, or at least taking a look at a lot of what these electives are providing and don't limit yourself. If you're interested in a specialty, there's a lot of like specialty based like electives, but then there's also a lot of electives that are very broad, and that can be helpful in deciding more generally like what kind of medicine or what kind of setting you want to do, regardless of like the specific specialty.
Thank you. Appreciate it.
Hi, I was just curious. As I was reading through the pathways, they all sound super interesting. So is there, I think you have to choose one, but is there a possibility to take like one-off courses in the other pathways, or you really just have to stick to your own?
I would say it really depends on the pathway. For my pathway, so I'm in addiction medicine. Like I said earlier, everybody in the pathway takes the opioid epidemic elective, but that elective is open to anybody who wants to take it. So we had a lot more people in that elective than we have in the pathway. Um, so there's definitely opportunity, at least for my pathway, to be involved, even if you're not in that direct pathway.
Yeah, same goes for the culinary medicine pathway. There's a foodist medicine elective that opened up, I want to say last year. So there's a lot of people who are in the foodist medicine elective that aren't in the culinary medicine pathway. So if you don't want to commit to the pathway, you can still do a little bit of it on the side. So
That's good to know. Yeah, I'd love to cook once a week or whatever it is. That sounds super fun.
Great questions. Who else wants to know more about pathways and electives? Anyone else?
Yeah, I have a quick question.
Go ahead, Lainey. Yeah.
Those of you that are in pathways, what kind of made you decide to commit to something so like longitudinal?
I can start off a little bit. I think coming into case, this may be a little too personal, but I think coming into case, I knew that no matter what, I wanted an experience in culinary medicine throughout my 4 years and like tailored my like med school process to be that way. And I think case especially is great for having some sort of longitudinal exposure to whether or not it's like a specialty based pathway or not, because just of the block schedule. And I think you just have, because the blocks are 10 to 14 weeks, exams don't come until the end of it. You have much more liberty to kind of get out of med school and like focus on other things that can complement your studies. And so I think seeing that, plus already having like the passion for culinary medicine or whatever it may be, kind of, made me just say yes. And I think at least for my pathway, and it looks like for a lot of others, the leaders and the people in charge of it seem to be pretty respectful of medical students' time. Yeah, I don't know if that fully answers your question, but I don't think M3 year, there'll be a lot of pathway involvement. I think it's mainly M1, M2, but I think Case for sure gives you the liberty to do this more than maybe other schools. So.
Yeah, I'll say that I guess I just always felt like it's more meaningful to me to like be part of something more longitudinal as opposed to something that only lasts like I don't know 3 or 4 months. Because like you can build like mentor-mentee relationships within it, which are very valuable in medical school, as you guys probably know. Um, and like I will agree, like I think that I had a strong interest in the med ed pathway to begin with. Like I felt like, maybe I wanted to do academic medicine, so I wanted to join it. And like since joining it, I only have good things to say about it, honestly. Like it's like I said, made me want to do academic medicine more. And I also have like mentor relationships that I formed through that pathway that will last like for all 4 years.
I will add, I think the fair where they have all the pathways that I'm pretty sure was mandatory is makes it a lot easier to commit because you get to discuss all these like things with current students that are in the pathway and see how it's affected them, how they enjoy it, see what like the longitudinal commitment is. So like for me, it was like, oh, okay, this is a great opportunity to like have this mentor relationship and be part of like a small group that gets to discuss things and have like interesting conversations for us like about vulnerable populations. um yeah, so I think it's nice to be able to talk to upperclassmen and it kind of reassures you like, oh, okay, this would be like a good fit. At least for me, it made it kind of easy to be like, okay, like I can do this for 4 years.
To add on to what Sherry said, if you're really passionate about a certain field like medical humanities or medical education or so on, then the mentorship that you get from a pathway really, really helps you over the course of even just like the 1 year that we've all been in here. Like it's really helped me at least. Back up like the folks who are in charge of the pathways and the advisors who lead these pathways, like Dr. Lamb for the medical humanities pathway, who's a different Dr. Lamb than the Dr. Lamb for the world medicine pathway, which I get is very confusing. There's two Dr. Lambs, but there's Dr. Lamb for the medical humanities pathway. Like she's always sending us emails about like research opportunities if you want to like submit to a conference or if we want to get involved with like ethics or art or whatever it might be. Like she's always trying to like help us with like research ideas or with um, places to submit like writing or poetry or places to perform or whatever it might be that's humanities related. So the mentorship that you get is just incredibly valuable. And I know that even like because the humanities pathway specifically is pretty like consistent in terms of its commitment, like we do have like M4s who come back um, who talk to us and yeah, it's just the mentorship is just very longitudinal and really personal. So
And I'll add just one last thing. So, I would also say, like, for me, I didn't necessarily have like a huge passion for addiction medicine before coming to Case. But when I went to the fair and just kind of thought about it more, like, no matter what I do, I'm going to be dealing with patients who have addictions at some point during my career. So I felt that no matter what I decide to do, like that will be a very useful skill set for me to develop. And another great thing about my pathway, like everyone's mentioned the mentorship, like we get assigned to a physician mentor in within kind of like there's a couple of different specialty options. They have to have some kind of tie to addiction. But for example, my main interest is OBGYN, and I got matched with an OBGYN who now practices in more of an addiction medicine space. So that's been really awesome to just have like an immediate like one-on-one connection. And then like everyone was saying too, the faculty advisors for the pathways are awesome. Like Dr. Perrin, you'll all will meet Dr. Perrin. He leads Tuesday seminars, comm workshops. He leads a lot of things around the med school, and he's one of the advisors for my pathway. So it's really cool to get to hear more from. He's just had like a wealth of experiences, and he's a great teacher. So I think even if you don't necessarily have like a huge passion for a specific like pathway, you can still definitely enjoy being a part of one and absolutely find it to be like a very valuable component of your or piece of your kind of vet school journey.
Can someone for me just quickly sort of summarize the structure of the fair? The fair has been brought up multiple times. Is it more of a presentation thing, or is it more informal with like tabling? Like, or do you have the opportunity to ask specific questions? Like, can you just describe the structure of the fair for everyone, please?
Sorry, I keep bringing up this fair without describing it, but basically, I think they had this presentation for everyone, just going over like the concept of pathways and what pathways were there, and then you got split up into like two rooms, I guess, and they each had tables with people in the pathway and some of the faculty, and you'd get to go kind of between tables and talk to them and listen to them talk about what they do. Is kind of how I remember it. If anyone else has any thoughts.
No, I think that's exactly what it was. It was like speed dating in a way, but like with different pathways. And every pathway had like their own little like flyer or brochure, with all like important dates, like when's the application due, and yeah, different info sheets. And yeah, you could also like talk to different upperclassmen who are in those pathways. Sometimes they like make time out of their day to go to like represent their pathway at the fair.
Great information. Thank you so much. That's very helpful to me.
I had a question about the surgery shadowing elective, and whether any of you have taken that, and whether you know whether there's like a similar mechanism of like the ecology one, where like you're matched to like a mentor that's in a field that you're interested in, because I think that's a great way to start connecting with people early.
Sherry, do you want to start in this one, and then I can
Sure,
go
yeah.
after?
Yeah, so I did a surgery shadowing elective at UH. Like I said, I got paired with a colorectal surgeon. So it's a lot like the cancer care elective, where you get paired with a preceptor and you just shadow them a couple of times. So this elective runs, the one that I did runs from like, it ran from I think October to now actually. I think it just ended. And I had to shadow my physician 4 times, or I think it was like 28 hours or no, that's not right. Four shadowing days is what I did. And it seemed
Yeah.
to meet the elective. And so, yeah, I think it's a really great way to build mentorship too, at least for the UH one, because this is like you're only assigned to that one surgeon and you just follow him around. I actually got research from him too. Like I'm doing a project with him. So I feel like it's just a really great way to reach out to mentors, and start something with them, especially if you're really interested in what they do. Yeah.
Cool. Awesome.
So the elective that I was in was run a little bit differently. So I was in the plastic surgery elective at the Cleveland Clinic. And with that one, you don't get matched to a specific person. You get a list of contacts of people in the department who have agreed to have students from the elective shadow them. So then, similarly, we had to do 4 half days, or just 4 blocks of 4 hours. So I ended up doing 3 days, and one of those days was a full day. But so you could reach out to, if you had a particular subspecialty that you were interested in. So I shadowed the breast reconstruction surgeon. I shadowed Dr. Basiri, who does a lot of gender affirming surgeries. So you can kind of tailor your experience a little bit that way and meet some different people in the department. Um, and then we got to interact with the research residents specifically a couple of times as well. And we did like our workshops and things. But similarly to Sherry, I know a lot of people in my elective who kind of leveraged that shadowing opportunity and that are now doing research with the people that they shadowed. So it's definitely a great networking opportunity.
Awesome. Yeah, that sounds great. Thank you.
So if I could just follow up with that, is that research that you're doing during the semester, or is this going to be research that you will be doing for your 12-week block over the summer? Or is it both?
It's kind of both for me at least. Like I started the project over like last semester and this semester, and I think like the bulk of the work is going to be this summer as well. Yeah.
Yep, same thing for, like I said, I'm not doing plastics research, but the people I know that are kind of have started now and will be doing again the bulk of their work over the summer, but it should be kind of a longitudinal thing. They're hoping to kind of work with those positions throughout their time here in med school.
Thank you. Thank you so much. All right. If you've got a question, we're coming up to the end of our hour, so speak now. What other questions do you have? Electives, pathways? We could even open it up to, topics outside of that if you feel like we've covered enough of that information. Go ahead, Nico.
I had a quick question. It's kind of unrelated, but a lot of medical students talk about doing clinical research. And I was just wondering, does the School of Medicine kind of prepare you for that? Do they hold any seminars on to teach you about clinical research? Or like, how do you learn about it and get into it if you don't have any clinical research experience?
So that's a good question because today some of us just had like a 2 hour like session on like how to write a manuscript and how to like submit an abstract and all that. So it's gonna be part of the curriculum. Part of uh we have like a separate research curriculum, especially throughout the first year to prepare us for our summer research. And those are usually like sessions that happen every couple of weeks or so, led by like the research faculty. And they'll walk us through, towards the beginning of the year, it'll be like how to find a mentor, how to identify a project, which I find actually very useful because a lot of this knowledge kind of comes through experience. But if you don't have experience, it's hard to like get in the game. And so they kind of like lay it out for you, uh, which is really helpful. And then as you progress, it'll become more like how to like develop, like how to like do a systematic review, how to submit an abstract, and so on and so forth. So there'll be resources and there'll be sessions to help guide you in the process of finding research, and that'll be helpful not just for summer research, but also just for research that you want to do throughout the year. And then not everyone does clinical research. So um, there are folks who do basic science research. There are folks who do clinical research. There's folks who do research in medical education, people who do research in like ethics, medical humanities, people who do it in like data science and like clinical informatics, which is different from clinical research. So the possibilities are endless, but regardless, there are resources and sessions that'll help you and they're relevant to most fields of research. But yeah, I would say that a lot of students do clinical research.
I can chime in there really quick. So, I had no experience with clinical research prior to coming to med school. All my research had been translational, and I'm working on a clinical project now. The school will definitely prepare you for it, and your mentor will help you as well. I think a lot of mentors don't necessarily expect you as an M1 to know how to do clinical research. But my summer project is actually going to be back in translational research. So again, not everybody does only clinical research. There's definitely students who do translational. So yeah, I'll be working with animals this summer if you have if you have any interest in that, it's definitely still possible.
I just want to add that like the school gives you so many resources and we have all these sessions, but they're also so available to talk. Dr. Hand, I think, is like the head of our research and scholarship department or something, and she's so available if you have any questions over email. I just emailed her and I was like, "Do you have templates for how to write an IRB?" She responds so fast. You can meet with her about like trying to find a mentor. So they're very available, not only like in our curriculum, but also outside if you need help in any way.
I just want to second that because I'm in a similar position to Anna, and she was really transparent and really clear. And then something I'll just add on is like clinical research takes a lot of forms. I did some clinical research in college, and now I'm doing clinical research. And I think something that's like underlooked is like when you look for PIs in clinical research, also expand your horizon to include not only MDs, but also look into MD PhDs who have like a whole degree in this, as well as just PhDs. Like I'm working with a PhD in medical sociology, but there's it's extremely clinical with pregnant patients and a bunch of referring OB-GYNs. And in that way, it's slightly more structured in like the statistical and like clinical trial component of it. So I think that's just like a pro tip that I found to be really useful. If maybe you're struggling to find like an MD, which they're really busy, but if you're struggling to find an MD who kind of like may not match exactly what you want, like open up your horizon to an MD PhD or a PhD who works with physicians. And you can also, because you can also have two mentors. Like I have my PI who's a medical sociologist as my primary mentor, but then I have a secondary mentor who's an MFM. And so it's like, it's just useful in that way. And you can like, maybe find some more options. So.
That's great insight and great advice. Thank you so much. All right. I think we have time for maybe one or two, maybe quick questions. Anyone have anything that they want to ask our panel while we're here?
What does the application process look like for the pathways?
So you get to rank your top 3 pathways. I remember that. And they like try to match you with any one of those 3. Obviously, like they try to match with your first one, but a lot of people sometimes they don't get their first choice. Um, and I feel if I remember correctly, I had to write some essays. Like they're like really chill though. They're like 200-word essays that I had to write to apply to my pathway. I feel like it's different though for different pathways, the application process. Also like I don't know if people know this, but like the caps are different for different pathways. So I think the med ed pathway we took 9 people this year. The wellness pathway takes like 30 or something, or maybe that's changed. But yeah, anyone else can speak on that.
Yeah, I think that application process really varies per pathway. So I know I applied to like wellness and urban health, and wellness, you just like film a video of yourself talking about why you wanted to be in it. And for urban health, I had to like write a few essays and then I had to interview. So I think there are only two pathways that like interview you. And so my pathway is really small. It's only 6 students per grade. But again, it varies. And I feel like that does affect your experience a lot. Like the size of your pathway, it just makes things different. And that also changes what the application's like.
For humanities, I think we have, honestly, we have like maybe 10 to 12 students per class. And then for the actual like application, I remember I had to write a couple essays. I think I had to submit a CV too, but there was no interview. So,
And then my pathway was similarly just a couple of like short paragraphs about why I was interested in joining. We did not have to interview. So yeah, it really depends on the pathway.
Perfect. Thank you guys. Appreciate it.
Oh my gosh, this was awesome. I learned so much. Let's give a big round of applause to all of our M1 students who are here tonight. Thank you so much. You guys were fantastic. I really, really appreciate it. We will post this recording on your Accepted Central portal. So if there's something like, oh, what did that one person say about that pathway? If you want to go back and rewatch this, you can. Or if you know of friends of yours who were like, oh, I wanted to attend and I couldn't, you can say, hey, it's been posted on Accepted Central. So you can direct your friends who wanted to be here but couldn't to that reference. Again, thank you so much. We're going to wrap things up now because again, I know how precious your time is, and we're a little past 7. So thank you again so much, everyone, for coming. It was great to see so many accepted students here. And thank you, thank you, thank you again, all you M1 students. You were phenomenal. I really appreciate it. I want everybody to have a great evening. Reach out if you have any other questions. Tom and I are always happy to help you out if you have any other questions as well. So thank you so much. Have a great evening. Bye. Awesome. Where's my stop recording? There we go.